What do the latest studies say about that, about the connection between adolescents' mental and physical health and social media? Again, I think we covered it, but are there any studies
Well, I
that?
think the recommendations really are looking at screen time for different ages. When
Mhm.
you're looking at 2 and under, it's only interactive with another individual, like FaceTime
Yep.
with your grandparents. When you're looking at that early preschool age, there can be some interactive content, some of the games, particularly if they're reading or math or letters, that can actually be helpful. But you want to limit to 1 to 2 hours a day.
Mhm.
When you're getting into school age should still also be that content should be there with an adult. There's not any recommendation to have a child have a phone on their own until really late middle school, 13,
Mhm.
14, eighth grade. And before that, content should be moderated by an adult, and there should be discussions there about around it. For all of those ages, including teenagers, there should be a limit on the time of contact, and it looks like 2 hours is the most that anybody should be on a phone.
Mhm.
And that there should be no phone use 1 to 2 hours before sleep. Optimally 2 hours, 1 hour if needed, because kids are working with each other on homework projects and things. But the thing is that if you think about your own brain chemistry and melatonin comes in when it starts to get dark. And if it's dark and you're on a screen, you are negating the whole effect of melatonin. So this is why we say stop the screens at least an hour, preferably 2 hours before that child goes to bed, because we didn't mention sleep and mental health, but sleep
Yeah.
is one of those things that doesn't happen when you've got a kid on a screen.